Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health.
Okay, so yeah.
Here we go. We're on the air, and before you know it, welcome to How to Stay Healthy, right here on WWNN, the Health and Wealth Network. I'm really glad to have on the program a nurse practitioner with a new practice in Boca Raton, and we're going to get right to the healthcare provider here. But I just want to tell you about All County Healthcare Incorporated. We're actually streaming live on their Facebook Live page. That's All County Healthcare Incorporated, where you can learn a lot more about them, and we'll get into a little bit more of that as the show goes on. I'm actually into the social media thing lately, so I'm actually right now sharing it on my page. So first time I'm doing that on the air as we're talking multitasking. Awesome. But I wanted to bring on Rachel Huerta, a nurse practitioner, direct primary care of Boca Raton, right here in Boca Raton, a primary care. And is it family medicine?
It is family medicine. So
okay.
Taking care of young kids all the way up to older adults.
Okay, when we say young kids, are we talking, is there a certain age that primary care family medicine starts, or is it?
Newborn all the way up.
Oh, really?
Yeah.
Okay.
So I'm a family nurse practitioner, trained here locally, and so did rounds all the way from maternity all the way up through geriatrics. So maternity services are not included. That would be the only prenatal care would not be included, but definitely newborns and up. So it's
from when after life starts until...
Exactly. You got it.
All the way. Well, what is your average patient range? I know you treat all ages, but I just like to ask because maybe, you know, there's a familiar age that you see.
Sure, yeah. Well, in our population in Boca Raton, you know, I do see probably more of a geriatric population than some other direct primary care practices have. But I definitely see this meeting a need for 20, 30, 40-year-olds and up. I think that there is an issue with health insurance, and so this really meets that need.
You got that right. Boy, I've been following it. It's hard to follow, but there's definitely an issue with health insurance. And as you know, I work for one of the hospital networks when I'm not here on the radio. But, yeah, that insurance landscape is tough to navigate, and just having someone in healthcare who knows about it and cares about it, because we're going to get into a little bit more, but I know you've even went to Congress and, you know, lobbied there. Well, yeah, I don't know if lobby's the best word, but...
Yeah, no, lobby's a great word.
Okay.
My husband and I had the opportunity to go up to Capitol Hill along with a lot of other direct primary care providers, and we went to our senators, and we just said, listen... direct primary care is a great answer. It's not the answer for everybody, but it's a great answer. And we want to be able to, for our patients to be able to access that with their HSA accounts. Right now, the IRS codes say that direct primary care reads more like a gym membership. And so while I can write a prescription for my patient to have an Apple iWatch for their fitness plan, they can't use their HSA to pay for a direct primary care membership. So we were lobbying to our senators to have them change the tax code so that it would allow patients who have HSAs or HRAs to use that as a payment form for a direct primary care membership.
And HSA is health savings account?
Exactly. They both accounts are something that you can put into, basically a savings for a rainy day.
Oh, nice.
So it's a great way to save and then use for healthcare later on down the road.
So you can actually save for your future healthcare.
Exactly.
What a genius idea.
I know. Like, not count on somebody else to pay for everything.
Yeah.
I love it. So that's what direct primary care is on the premise of. It's you're in control of your health care. It's using modern medicine with old-fashioned compassion, and you know the relationship you have with your provider. There's transparent pricing. You know up front, you're not going to get a bill later on in the mail saying, by the way, your insurance didn't cover this, so you're responsible for this amount. So you know exactly what things cost, and you can save up for them.
That is really awesome news because, like I said, as listeners know, I tell all the people all the time, they know my size, they know my weight, everything's good. They know my age. And when I turned 35, things just started falling apart. And this is the first time I ever started going to the doctor in my life. And to hear something like this, after what I've gone through the last 5 years, where I could actually save, you know, for future health events, is just awesome news. Let me ask you this, for the listeners. So it's direct primary care of Boca Raton. Now, we've heard recently about VIP concierge health. Is this the same kind of concept?
It's very similar. And so I like to point out some of the similarities and some of the differences. So the type of care that you get with concierge and direct primary care, it's very similar. You're going to get unlimited office visits, a lot longer visit time in the office, telemedicine, more personalized care. The difference between direct primary care and concierge care is that direct primary care does not involve any health care insurance. So a lot of my patients do have health care insurance, including Medicare or an emergency insurance plan, which is what we recommend. But what they pay to my office is a monthly membership fee, and I do not bill their insurance. So that's the primary difference between concierge and direct primary care. The other difference is direct primary care is usually about half the cost of a concierge practice cost for patients. And direct primary care is not a franchise. So every direct primary care practice is different. In my direct primary care practice, I'm not asking patients to sign a 6 or a 12-month contract or pay the whole year up front. So that also sets us a little bit apart from what a true concierge practice would do.
And you mentioned, I have a few questions. You mentioned telemedicine. What actually is telemedicine?
Yeah, I love that question because we're catching up now with the times. So telemedicine includes text messaging, emailing, phone calls, and then video conferencing. And I'm really excited that we're using a program called Spruce Health. And Spruce Health is available to all of our members, included in their membership. And it's an app that you can download onto your computer or your phone. And with that, you can access your provider 24/7. So let's say you're out of town, you have a rash, you're concerned about it. You can text me and say, hey, Rachel, this popped up. Is this something that we can deal with here? Should I come back and have you take a look at it?
And you can actually give that answer?
Exactly, yes.
Wow.
You know, one of the big reasons why we don't use telemedicine in a traditional practice that's insurance-based is because it's very hard to get reimbursed for that. So we end up doing a lot of services that we can't get paid for on the back end. So it kind of inhibits practices from being able to use some of those services. But you'll find some health insurance plans that are trying to now incorporate that as an extra fee for their patients. Like they usually have a hotline. If you need somebody, you can call your nurse through your health insurance for an extra, X dollar amount. The problem with that is it's not your healthcare provider. So the nice thing with our telemedicine is that you're getting your healthcare provider.
Man, that is such a good deal, because when you're on vacation, it always seems to happen. Something comes up every time, or to a family member or wife, husband, the kids.
Exactly.
And to have someone that at least can take your mind off that and say, hey, let's look at this when we get back, or hey, get to the nearest emergency room. It just baffles me why we've been so far behind before hearing from you. I mean, this is like the future of medicine right here in Boca Raton.
I believe it, and I'm excited because while direct primary care is catching on and about 3% of family physicians are moving towards direct primary care, I get to be the first person to bring it as a family practice to Boca Raton. So really pioneering this whole movement here.
It seems like also it's new to Palm Beach County, because I haven't seen this and I'm all over the county.
Exactly.
Really? Wow.
There is, as far as I know, there is not another family direct primary care practice in Palm Beach County. You will find some further south in Miami, Sunrise, north in Orlando on the West Coast. But for some reason, there's this big gap. So I'm really excited that I get to help fill that gap for our area and let people know, hey, there's a different way. It doesn't have to be just through insurance.
And if you're driving around, or you see us on YouTube or Facebook Live or wherever else in the global sphere, you can call in right now to 1-888-565-1470 and get a question with Rachel Huerta, nurse practitioner, direct primary care of Boca Raton. So call in if you have any questions about this. This is really great news in the world of health, which sometimes we don't get in the U.S., to be honest with you. I want to ask you, you made a great point, longer visits. And this is something that I've heard about nurse practitioners. I actually have a family member who sees one now instead of a doctor. And the first thing that they said is they spend so much more time with me than most doctors have in my life. And the visits they're longer visits, exactly what you say. Why are you able to spend much more time with the patient than, say, a traditional sense?
Sure. So in a traditional practice that's insurance-based, most providers have about 2,500 patients per provider. That's a lot of patients.
Whoa.
So you can imagine that their schedules are busier, and their billing is a little bit different. You only get to collect and bill based on when a patient comes in. So they need a larger volume throughout the day to be able to keep their practice running financially. So when you do a direct primary care practice, which is a membership-based, those patients have access, but every month are paying into the practice. So we can have a panel of patients that's under 1,000 per provider. So you can imagine we can spend a lot more time with our patients, which if you think about it, if you spend more time with your patients and you don't say, well, you're here for a rash, so we can't talk about your depression or your anxiety, but rather we can talk about everything that we need to talk about with you, then you're better off. And you don't need to come in as many times. It just makes sense.
Yeah, it does, definitely.
So if we can address all of the needs that you have at one time and sit down, as long as that's something that you want to do, then it just makes sense to do it rather than say, I'm sorry, you're here for this and we can't talk about those other issues. You'll have to come back at another time. Oh,
that's a good point. And another point you made is membership. Now, I was looking at the membership prices, and I have to tell you, I was absolutely surprised at how low they were. Now, is it done on an age level? Say like, and I don't have, you can tell me if I'm right or wrong, like 20 to 30 is a certain amount. 20,
sure,
30 years old.
I'll go over the prices because that's exactly how we did it. My husband and I, his name is Jody. He's really a business-minded person and has helped me through this whole process. So he definitely gets a lot of credit for this business opening up. But we looked at different ways of how could we be able to have people come in and what the membership cost should be. And we just wanted to make it simple. So kids are $35 a month, and you do have to have an adult with a child membership. The next price group would be 19 to 39, and that's $65 a month. And then 40 to 59 is $85 a month. And then 60 years old and up is $100 a month.
Okay, and that's unlimited?
Correct. Unlimited office visits. And then each office visit, you can get about 30 to 60 minutes at a time. And really, I've been doing primary care for a long time. The average time that a provider spends with a patient is about 7 minutes.
Yeah,
so to have 30 to 60 minutes per visit, that's a massive difference.
Isn't it unbelievable, everyone, that the average time a provider spends with you is less than 10 minutes? It's 7 minutes. That's just astounding. Hold that thought. We're going to take a quick break, but I want to let everyone know they want to call in. We still have 15 more minutes, 1-888-565-1470 on the How to Stay Healthy show. How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life doctors pursue when not providing medicine.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And welcome back, everyone. Thanks for joining us. We have just an awesome show with a ton of information today with Rachel Huerta, nurse practitioner, direct primary care of Boca Raton. Numbers there, 561-530-2622, or a great website, dpcboca.com. It's the letter dpcboca.com. Rachel, I wanted to also ask you, we've got a lot of info out there, but I want to ask you kind of the areas of interest, if you have a certain areas of interest that you treat, or is it kind of everything primary care, family medicine, or family practice?
Yeah, I love seeing the whole family. So that's one of the things that I really enjoy, taking care of the kids and the parents and their relatives, getting to know the whole family. I think that's really key in taking care of people. I think a lot of things get missed because we don't understand the dynamics of the family. But I love doing preventative wellness. We do a lot of, prevention of hypertension and diabetes, heart disease. So I love that. Education's great. If we can prevent illnesses and keep people off of medications, I think we're winning. Yeah, preventative medicine is where it's at. I mean, that's how we can really extend our life expectancy, right? Definitely. Because when you take care of the heart and the brain and the vascular system, I mean, the benefits are just amazing. I wanted to also ask you about, because it's that time of the year, I actually just got an email today. I got to do it next week. Do you give flu shots? Yep. A flu shot is included with your membership, and that's because we believe in prevention. Wow. So we know that influenza, it can be very serious, especially with certain populations, younger and older people. So we want to make sure that we keep people out of the hospital and the urgent care centers as much as possible. If we can, take that proactive approach, that's great. A lot of reasons why people don't go for their wellness visits or for vaccines is because they can't afford it. So we thought that was really important to include that. And it's important too, right? Because even if you're healthy, man or woman, the thing with getting the flu is it's easily given to someone that's elderly or young. And then that's, like you said, when it hits that population, that's when it's the problem. Exactly. And sometimes you can be infectious and not realize it. And nobody intentionally infects somebody else. But, we live in a population where it's easy to spread germs. So why not take that extra measure and go ahead and get the vaccine? And I'll tell everyone, I've gotten a lot of flu shots in my lifetime. Obviously, I don't like needles like anyone else. It doesn't even hurt. Not even to little kids don't even make a noise with the flu shots. Just get it done. And what about things like, I know this because I just had, my wife had a baby, but Tdap and those kind of immunizations. Right. So here's a really cool thing. So with direct primary care, I'm your advocate, right? So I am advocating for you by negotiating costs for you. So we've already talked about the membership of the practice, and that's that monthly membership that gets you office visits and telemedicine visits. So a lot of people ask, but what about the other stuff? What about the labs? What about the imaging and the vaccines and the medication? So this is a really cool part. Vaccines, we're going to be joining a group purchasing group organization that we're going to get discounted rates on vaccination so that we can provide that. Medications, we're going to be able to dispense generic medications for things like antibiotics and blood pressure management and diabetes, and that's from a local wholesaler. Labs, we've negotiated rates down for a lab panel that includes a blood count, a metabolic panel, lipid profile, thyroid check, a diabetes screening with an A1C, and a urinalysis. We've been able to negotiate that down to $25 for all of those tests. And the same things with imaging. We've been able to go to our local imaging centers and say, this is what we're doing. What can you do for our patients? And they've given us cash amounts for those imaging things. So although there are going to be some things outside of that membership that patients may need to save for so that they can pay, on a rainy day, that's very affordable. But that's something, if they have a health savings account, they can do that. Exactly. And all those things you can use the health saving account for. And we're getting near that time of the year of open enrollment again. I know I just got that email too. It's like I'm getting all these flu shot, open enrollment. It's that time. So it's a good time to take the time one night, turn off the TV and read about these different options, because
if you do your research, you're going to find the best option for you. I've had it, and it's worked.
Exactly. Good. Yeah, we were intentional about when we wanted to start our business, and we wanted to do it during a time where patients could make changes if they wanted to. I like to reiterate that our direct primary care membership is not an insurance plan. So at the end of the year, if you don't have an approved insurance plan, obviously there might be some repercussions for that. But we do encourage patients to have some form of insurance that would cover them in an emergency situation. So if they do need to go to urgent care or they do need to go to an ER, they have some form of payment. I don't want them to become vulnerable. But some great options are either a very high deductible with a low premium plan, or even some of the health sharing organizations. And one of the ones I like to highlight is Direct Health. They have a health sharing organization that is approved through the Affordable Care Act, and they actually reimburse a portion at times of memberships of direct primary care patients. This is what we've been told. So not only is it more affordable than sometimes some of the commercial plans, and they do offer family plans, but then they also work together with direct primary care patients. So I think that's win-win for everybody.
It's definitely a win-win for everybody. I mean, there's some of the things you said. I mean, this is like a wish list for patients that you've created. Telemedicine, something that I asked you about, I knew a little bit about, but it's something that I would definitely do because I like to travel. And like I said, it always happens. The longer visits, I have a lot of questions. I'm a journalist. I'll ask questions until the doctor kind of peels away and just like is annoyed with me. But just having time to ask questions, because I actually write things down in a notebook and come there. The membership, the costs, they seem, I think they're lower than a lot of gym memberships I'm looking at.
That's true.
And negotiating costs. And even so, I mean, they're on par with gym memberships as well, because that's a cost that I think people can actually afford for once. Because sometimes when you have insurance, still the deductible and all that to meet all that is just a lot. And negotiating costs, that's something that you don't hear in the healthcare field a lot lately,
right?
And especially with the labs.
And a lot of people don't realize that that's even an option. They'll say, oh, well, I have insurance, so I have to pay the insurance rate. Well, no. You do have the right as a patient to ask if there is a cash rate that you can choose to go to rather than through your insurance. So it's something that, to me, it just made sense. I have a lot of patients that had changes to their healthcare plans over the years, and they were signing up for these plans through the marketplace and then coming back to me asking if they can come and see me because I don't take their plan that they're now on, and paying me out of pocket a lot of money to come back. And I said, why are you doing this? And they said, well, I'm not getting the same type of care that I get with you, and I'm paying, a lot less money for my insurance, but I'd still rather come and pay you cash. I said, there's something wrong with this picture. We got to do something different.
Yeah, and like you said, you guys launched at this time of the year. You really took the time. I can tell by the time when you started your Facebook page that you took the time to do this, and you kind of built it up, and it wasn't rushed. Exactly. And I think everyone knows when you take the time to think something out, the outcome's always better. So kudos for doing that.
Thanks.
I want to ask you just a couple more questions. Listeners always like to know, why did you get interested in medicine? It's like the one question that I have to have in my Q&A there.
Yeah, sure. I love to answer that. So I had the opportunity in high school to go through a health occupations program. So for all those teachers out there, you really make a difference in the lives of your students, and that really just spurred me on to want to go into healthcare. I got to shadow a lot of different fields, and I loved the medical field. So I did that, and then I became an RN. And that was a great experience. Started working in the hospitals, but what triggered me to want to go back for my nurse practitioner degree was going over and doing a medical missions trip in Tanzania. And I had that hands-on experience where I got to take care of patients and diagnose and treat over there under the supervision of a physician. And I came back and I said, I love it. I got to do this. So I came back and finished my education.
I know that's in Africa. Where in Africa is Tanzania?
Sure, yeah. Tanzania is just below Kenya. So it's on the east side of Africa. It's beautiful. People are amazing. I still keep in touch with the doctor of the clinic and through WhatsApp. Love WhatsApp. And so that's my heart, in medicine. And it's been really neat to partner with the Rotary Club of Boca Raton. I'll just plug them because they've been a huge support both in Tanzania at the medical clinic, and just helping me professionally take that leap of faith to go forward and open up my own practice.
Oh, definitely. You're a very smart woman. I got to give you that. And WhatsApp is something that's been in my range lately because of the hurricane. It's how we all communicated for a few days.
Yeah.
But they're awesome too. That's great though, helping out and over there and learning a little bit more about a different culture and the different way they do things, the different way they live.
Exactly.
And we know Africa needs help. I know we only have a couple more minutes here. You mentioned high school. Where did you go to high school with that occupation training?
Sure.
class?
I was at South Plantation.
Okay.
So,
I saw that, yeah.
Yeah. So I was a paladin.
wow.
My junior.
What
and
is a
senior
paladin?
year.
I need to look that up.
It's the knight on the horse with
Oh,
the.
yeah. Okay, got
Yeah.
it.
I didn't know what that was either until I went there.
But before that, you were a warrior.
Before that, I was a warrior at Jupiter. So we have that in common, and we loved our time living in Jupiter. It's a beautiful place,
is.
and go the Marching Warriors. I was a marching band kid, so that made a big difference in my life too.
And I played for the Jupiter Warriors football 92 to 96, and we had the #1 defense in the county.
I can
3
believe
straight
that.
playoff years.
I can
Played
believe
against
that.
Fred Taylor in high school. A lot of people know that. I just want to also, you went to FAU. I went to FAU, right? Is that where you did
Yep,
your
I went-
education?
That's right.
Okay.
Yep.
Nice.
I completed my master's degree through their nursing program, and I chose the family nurse practitioner program because I wanted to one day be able to take care of patients in the type of setting that I'm doing now. So it's really neat to just see my dream kind of come to fruition through that. But it's a great school. I love being next door to it now, and as I'm
Yeah.
opening up my clinic, and I've preceptored students from other nurse practitioner programs, and hope to see that full circle. Maybe one day I'll get to teach or preceptor FAU students.
I
Who
think
knows?
it'd be a no-brainer for FAU if they're listening. I know they are, to talk to Rachel Huerta, nurse practitioner, direct primary care of Boca Raton, 561-530-2622, dpcboca.com. Remember, if All County Healthcare cares for seniors and adults, 954-717-7027. Thank you.
Thank you.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.